Hi, my name is Brittany Spence. I'm a family nurse practitioner student here at Arkansas State University, on track to graduate next month. The purpose of my quality improvement project was to look at a rural clinic in Arkansas and look at their adherence to the hepatitis C screenings and guidelines in patients born between 1945 to 1965 and those considered high risk. There were new guidelines that came out in 2013 that recommended a one-time screening for patients born between 1945 and 1965, which is also called the baby boomer era. Previous IV drug users, long-term dialysis users, blood products before 1992, HIV, abnormal ALT, and if they received clotting factors before 1987. More than 3 million people in the United States are living with chronic hepatitis C, and most are asymptomatic, according to the United States Department of Health and Human Services. There are approximately more than 17,000 new hepatitis C cases reported each year, and at a more local standpoint, 22,000 people are living with hepatitis C in Arkansas. Objectives of this study was to determine if local providers in a rural health clinic in Arkansas adhered to the current hepatitis C guidelines. I analyzed 50 patients at risk for hepatitis C that were seen in the clinic from January 1st, 2019 to November 1st, 2019 to see if they were screened according to the current guidelines and compare it to the national average. This was a quality improvement project using descriptive design with a randomized convenient sample through a retrospective chart review of 50 patients. Inclusion criteria included males or females born between 1945 and 1965, and those patients considered high risk. Exclusion criteria included males or females born outside the baby boomer era if they were not considered high risk, and low risk patients. If you look at the population reviewed, 96% of the charts that I had pulled were patients born between 1945 and 1965, also considered the baby boomer era, which was no surprise to me due to being in this clinic for some time now. Most of the patients were most likely born in this time frame. The other 4% of the charts reviewed were previous IV drug users, and the other categories had 0%. My findings did show that 4% of the patients whose charts were reviewed were tested for hepatitis C. However, those 4% were the previous IV drug users' charts that I had previously pulled. I compared this to the national average of 12.8% that was found in 2013 to 2015, right after the guidelines have came out. The rural health clinic percentage of 4% was much lower than the national average, which was to be expected. My retrospective chart review of 50 patients was done in a rural health clinic in Northeast Arkansas. Most of these patients that we have seen in the past were born in the baby boomer era. So 96% of the patients' charts reviewed were born in that time frame. However, none of these patients had hepatitis C screenings that I could find. This presented a great opportunity to educate the providers in the clinic and show them my findings. I'm hoping that they will take in account my findings to help improve patient outcomes in the future. This is everything put together on one slide. This is what my poster would have looked like in person. I hope everybody could take something out of this presentation today, and I thank you for listening. I am honored to be a part of Create AState this year, and thanks again.